Welcome back to an introduction to recovery residences. In previous videos, we've talked about recovery housing in the past and in the present, but what about the future? What's next? Based on key events in 2018, it doesn't require a crystal ball to see the trajectory of recovery housing. We can easily predict that there will be a reduction in corruption via awareness, regulation, and education, that there'll be widespread promotion of best practices, and that there will be a replication of the voluntary certification program linked to national standards and best practices in all 50 states. While a majority of recovery housing providers continued to operate legally and ethically, we saw a rise of corrupt business practices starting in about 2012. This was fueled by profits, and these practices overtook some marketplaces, such as Florida, but really it spread to other states as well. Um, Profits, marketplace pressure, and business consultants normalized these corrupt business practices, which further increased the problem. And as a result, the U.S. Government Accountability Office, also known as the GAO, was asked to examine recovery housing in the United States and essentially answer the three questions. What is known about the prevalence and characteristics of recovery housing across the United States? What investigations or actions have states undertaken to oversee recovery housing, and also looking at SAMHSA's funding for recovery housing, or how states have used this funding or really any available funding for recovery housing and to address various issues. So the GAO reviewed national and state data, federal funding guidance, and interviewed officials from SAMHSA, national associations, and they chose 5 states, kind of a sample of the 50 states. They looked at 5: Florida, Massachusetts, Ohio, Texas, and Utah. They was selected based on rates of the opiate overdose deaths at the time, dependence on or abuse of alcohol and other drugs, as well as some other criteria. The state's information really was intended to be illustrative and not generalized to all states. So, looking at the results for the 5 states that the GAO interviewed, being Florida, Massachusetts, Ohio, and Utah, had conducted or were in the process of conducting investigations on recovery housing activities in the respective states. And 3 of the 4 states had taken formal steps to enhance oversight based on what they'd been seeing. The 5th state, Texas, had not conducted any such investigations at the time of the GAO review. And I'm from Texas, and we often say just because there wasn't investigations going on doesn't mean that it wasn't occurring in Texas, because anecdotally we saw that type of behavior here in our state. The fraudulent activities identified by the state investigators included a wide range of things, including schemes in which recovery housing operators recruited individuals with substance use disorder to specific recovery homes and to specific treatment programs, who then billed the patient's insurance for extensive and unnecessary drug testing for profits or for the purpose of profits. So, based on the GAO report, there was a rising awareness of this problem. A group of national thought leaders and stakeholders, led by the National Council on Behavioral Health, in collaboration with the National Alliance for Recovery Residences, identified and published solutions in a document called Building Recovery, State Policy Guide for Supporting Recovery Housing. So, whereas the GAO report really pointed to the problem and what some states were doing, these national leaders wanted to look at, so what are some solutions, best practice solutions that we want to recommend as a state policy across the United States. So the recommendations include to adopt a definition of recovery housing and establish a certification program based on national standards. 2, incentivize recovery housing operators to adhere to nationally recognized quality standards. And 3, expand investment in and technical assistance for recovery housing. So the policy guide helped inspire, Congress into action, and Congress included recovery housing in some historic legislation, which was passed in 2018 called Support for Patients and Communities Act. And in that, I believe it was HR 6 or Support Patients and Communities Act, there's a subsection called National Recovery Housing Best Practices. And what it calls for is to identify or facilitate the development of best practices, which may include model laws for implementing suggested minimal standards for operating recovery housing. So, really kind of geared towards how do we educate states. And there were several $1 million that were allocated to Health and Human Services and at the federal level, and the department within Health and Human Services that really focuses in on this area would be the Substance Abuse and Mental Health Services Administration, which is also known as SAMHSA. So the Act calls for best practices for identifying or considering how law enforcement, public and private payers, and the public at large can best identify and report fraudulent recovery housing operators. I think that as these corrupt business practices were unfolding, they were so numerous and so complex that a lot of people had a difficult time getting their head around it and understanding. So, what's fraudulent, what's not, what's ethical, what's not ethical. And so really creating a set of best practices and then educating everyone around that, as well as so when you think you see something or you see something that's fraudulent, where do you even report that? The Act also calls for best practices to be widely disseminated. So it's just not only developing this best practices, but we need to get it out there to state agencies. And the Act specifically says in disseminating best practices, there also SAMHSA can also offer some technical assistance to state agencies that want to implement best practices. But beyond that, disseminating this to the Indian tribes, to the U.S. Attorney General, Secretary of Labor, Secretary of Housing and Urban Development, also known as HUD, to state and local law enforcement agencies, health insurance issuers, recovery housing owner and operators, as well as the public at large. So widespread consensus views voluntary certification as best practices. So, we can already see what is being used and is being considered as best practices that we're almost guaranteed is going to end up in that SAMHSA report that goes out. And voluntary certification is the kind of linchpin because it promotes best practices and promotes access to quality care without raising impediments to fair housing choice. And just as a note, individuals in recovery from substance use issues, so the residents of a recovery house, meet the civil rights definition of disabled, which is a protected class under fair housing. And so that restricts what local and state governments, how they can regulate recovery housing, because overregulation would end up undermining the civil rights of individuals. And we're going to cover this in greater detail in other sessions. But just for now, understand, so this voluntary certification program was a way of promoting best practices while still adhering or furthering civil rights. In addition, it complements without replacing existing regulation. It provides consumer protection and a grievance process, a process of checks and balances. It's also strength-based. We can really help providers who maybe have unwillingly stepped into an area that is causing problems. We can educate them how to get back to the right path towards best practices. It's also a public-facing mechanism that empowers choice and instills confidence for consumers, for funders, as well as referral agents. And not to mention, it's cost-effective and flexible over time as compared to a regulation. Regulation, that's a law that's being passed, and then enforcing regulation can be expensive. And then if you've ever tried to pass regulation, you know that is a very slow wheel to turn. And so certification is much more timely and flexible. So it's important to link certification to national best practices or national standards. And the benefit to national standards is that you have standardized nomenclature or language that allows for more productive and meaningful conversations, apples to apples conversations. This can translate across states, and later videos we're going to talk about how state laws can differ and really shape what type of recovery homes can exist. And so, having a conversation about recovery housing across state lines can be challenging unless we standardize it at the national level. It also can be inclusive of all the types of recovery housing, recovery residences that exist out there. And we'll talk more about the levels of support that the National Alliance for Recovery Residents has defined, which is a inclusive framework. It unites a fragmented industry and a fragmented knowledge base, and it facilitates the collection and promotion of best practices, because this is an ongoing field and that needs to be responsive to the changes in the world. So this is a mechanism to collect those ongoing best practices and then in turn promote those. And it offers a blueprint to providers that want to step into the recovery housing industry, new capacity, or existing capacity can increase quality. And it equips researchers with comparative subjects. I mean, one of the barriers to studying recovery housing is, how they're not necessarily standardized. And so national standards would help researchers establish that recovery housing is an evidence-based program and practice. And it's also the basis of a certification program. So the leader in all of this since 2011, and really, we'll talk about their connection with even older organizations that reach back into the 1950s. So the leader when it comes to establishing standards, really curating best practices across the United States to inform the standards, and then empowering state affiliates to in turn use those standards to certify recovery housing in their respective states. That leader is the National Alliance for Recovery Residences. So you can learn more about them at NAR online. As of this recording, there's about 25 states that have NAR affiliates, and at different various levels of maturity, meaning some have implemented certification programs for years, others are putting that together now, others are aspiring to put that together. So already about half of the United States is working with NAR in this direction, and we anticipate, because of everything that we've talked about in the last few minutes, that all 50 states will end up having a NAR state affiliate. So that concludes this session. I hope you enjoyed it and learned something, and that you will tune in for the next session to learn even more. Thanks.